Welcome everybody to the Community Technical Assistance Center's webinar on aligning with healthcare reform, the role of cultural competence at the organizational level. We're going to wait one more minute. There's a number of people that have registered for today's webinar, and we're just going to give everybody a chance to log on. Thank you. Welcome everybody to the Community Technical Assistance Center Lunch and Learn webinar on aligning with healthcare reform, the role of cultural competence at the organizational level. This is a two-series webinar that we're very excited to be able to present to you. The second webinar will be looking at cultural competence at the programmatic level on April 29th at noon. For today's webinar, we're excited to have from the Nathan Klein Institute for the Center of Excellence in Cultural Competent Mental Health, both Gary Hoagland and Lenora Reed-Rose. Carol Siegel couldn't join us today, but she's very well represented by both Gary and Lenora. Before we get started and I pass off the presentation to our presenters, just want to do some quick housekeeping around the webinar system. If it's the first time you've joined us, just want to orient you to what you see in front of you. Everybody is currently muted. We have a number of registrants, so if you'd like to communicate with both the presenters, the panelists, or the host, or if you're having any technical issues, please use the chat box that's on the right-hand side towards the bottom. If you don't see the chat box right now popped up, there's a little bubble that says chat on the top right that you can click, and that should pop up the little box towards the bottom right. Make sure that when you submit a comment, a feedback, a question, that you hit send to all panelists in the drop-down before you hit submit. That way all of us can see what your question is or your comment is. So everybody knows the webinar will be recorded. The slides and the handout will be posted on ctacny.com website. We are very happy to be partnering with the NYU Silver School of Social Work to provide everybody with 1 CU credit for social workers for participating in today's webinar. We will give information at the end of the webinar about how to access the CEU. We do require that everybody participate all the way through the entire webinar in order to get credit for the CEU. So please make sure to stay on to the end, and that's where we're going to give you some extra information about how to finish processing to get your credit. So without further ado, I'd like to pass the ball to Gary Hoagland and Lenora Reed-Rose from Nathan Klein Institute. Thank you so much for being available to present with us today.
You're very welcome. We're really pleased to be here as well. I hope you can hear me fine. My name is Gary Hoagland. I'm co-director of the Center of Excellence at the Nathan Klein Institute, Center of Culturally Competent Mental Health. And I'm here with my other co-director, Lenora Reed-Rose. Do you want to introduce yourself?
Hi, thank you, Gary and Lydia. I am Lenora Reed-Rose, as Gary just mentioned, but I also am the Director of Cultural Competence and Diversity Initiatives for Coordinated Care Services, Inc., while I serve as the co-director at the Nathan Klein Institute. Just want to add that little tidbit.
Yes. Can I have the next slide, please? So we're here today to really describe an instrument for measuring the level of activities related to cultural competence of an organization. In complex systems of care, there is a great value added by addressing cultural competency at all levels and in all domains. And we provide some background on the development of the scale, the challenges of measurement, and the ways that a scale can help sustain gains in cultural competence. Next slide, please. We're going to start with a polling question. Does your agency have a plan for incorporating cultural competency in services? Brianna, do you want to explain the process?
Sure. So there's a poll that just popped up on your right-hand side. Does your agency have a plan for incorporating cultural competence in services? If you can just hit yes, it's clearly defined. No, yes, but it is unclear. No, not at all, meaning we don't have a plan. Or I'm really not sure. If you can just click your response and hit the submit button at the bottom, then we get a chance to see where kind of everybody is in this process. It is very helpful for us to hear from as many of you as we can to kind of help guide the rest of the presentation to understand where everybody is on this path of cultural competence.
Okay, and I think I'll continue the presentation until we tally those, and then we can discuss the results as we go. Next slide, please. Yeah,
actually, it's about to pop up momentarily.
Okay.
So we can see that pretty quickly, actually. Sometimes there's a slight delay.
Okay.
5 seconds, and then you'll see the results will pop up again on your right-hand side. Thank you very much, Brianna. So what we have is some of you that were able to respond. We have many of you who said, yes, it's clearly defined. We have a few that said yes, but it's unclear. Only a few of you have said no, not at all. Some are not sure, but it seems like most of you are either on yes on some level in that path.
Great, good to see, good to know that. Now here is a chat question. Does this follow the same way that there's a time limit?
Yeah, so no, there's no time limit on this one. So what we want to do is hear from everybody. Again, just to get a gauge for where everybody is in terms of utilizing a plan for cultural competency in your organization. So now that many of you said that you've considered one or you are utilizing one or have, if you can use that chat box on the right-hand side and let us know how are you incorporating cultural competence principles into your organization. What is the plan? Can you give us some quick pointers and ideas around what you're already doing and how well that's working? So again, you can do that in that chat box on the bottom right-hand side. In the drop-down, make sure to choose all panelists. That way we can see your response and hit send. So sometimes there's a little bit of a delay in us seeing your responses, so please go ahead and just submit those as soon as you can.
Okay, and then so we can continue with the presentation then?
Yeah, so we can continue, and then as soon as some of the replies come back, I'll let you know what folks are saying. But just as a reminder, please let us know what is it that you are doing to incorporate cultural competence. And actually, we just got a few coming in. Cultural competence training is one method. Many of you are typing in. Thank you so much for participating. Some have annual cultural competence training, departmental and agency level. We have some that have some rules and philosophies that are outlined in their code of ethics in some way. We have some that incorporate questions around cultural issues in their admissions process or their intake process. It seems that folks are primarily doing orientations or trainings on a regular level, periodic interval, and some evaluation as well. Thank you, everybody, for submitting your feedback. That's very helpful.
Okay, so we are trying to tie this presentation with the triple aims of healthcare reform, particularly here in New York State, where there is a lot of activity, I'm sure you're all well aware of, related to some degrees of healthcare reform, Medicaid managed care, and so on. So what we know is that it's important to reduce disparities among persons with behavioral health conditions because that provides a lift to the overall health of the population. And by emphasizing quality over quantity, the reforms include benefit from cultural perspectives on what quality means, resulting in greater likelihood of effectiveness and satisfaction. And costs can be reduced when early community-based treatment is effective in staving off or delaying the most costly services, emergency room use, inpatient hospitalization, and incarceration. Next slide, please. In New York State, the diversity of the state is reflected in these kinds of statistics. Of the almost 20 million people in the state, 22% are foreign-born, representing 35 countries with more than 10,000 residents in the state. The major languages currently, other than English, are Spanish, Chinese, Haitian Creole, Russian, Italian, and Korean. But among those, 13% have limited English proficiency, which really places a large burden on each of the provider organizations. There are also 170 different religious bodies through a 2010 survey. I guess those would be called denominations, with 14,000 congregations and over 10 million adherents here in the state. Next slide, please. In terms of the broad racial and ethnic group distribution, you can see that we are now at the tipping point. Only 48% of the population is white, non-Hispanic, with the Hispanic, African American, Asian, and other groups, and those reporting more than one forming a majority now. Now, if we look at the younger population, the under 18 population based on the census, this hints at the increase of the non-white population and possibly linguistic challenges. Hispanic, under 18 Hispanics account for 23% of the population. African American 17, Asian 7, and other and more than one are 15% of the population. So you can see that this diversity is going to be increasing over time. Next slide, please. So here we have another polling question.
Yeah, so wonderful. We just wanted to get a little bit more feedback. Again, the poll has popped up on the right-hand side. Do you know the cultural groups that are served by your agency? So it'd be helpful to know just where everybody is on this process as well. And so yes, we ask regularly. We specifically ask folks what their cultural background is or their race, ethnicity. B is yes, we think we do, but we don't necessarily ask regularly. C is no, not really, don't really have a good handle on that, or D, not sure. So thank you everybody for being so great at participating in our last poll and all the feedback. If we can get a lot of participation here, that'll also help guide some of the conversation. So again, if you can hit your response and click submit, momentarily we'll close out the poll and then we'll see the results in just a few seconds. Results will pop up in just a couple seconds. So do you know the cultural groups that are served by your agency? So thank you so much. We had a great participation. Most of you who replied said yes, we ask pretty directly and regularly. A few of you, we think so, and then nobody that says no, and then a few maybe that are not sure. So that's really helpful in kind of understanding how familiar you are with your cultural groups that you serve. Thank you.
Okay, next slide. We know and we understand and believe that cultural competency will improve the treatment encounters of people from different cultural groups. We did an ethnographic study of culturally focused programs that revealed strategies for addressing cultural features that are broadly applicable. A key to treatment engagement is building trust and reducing stigma that may be culture specific. Examples from our study include communication styles, not just language, culturally tailored family psychoeducation, and peer mentorship that builds on skills rather than eliminating symptoms. Next slide, please. Cultural competency can reduce disparities. Culture can be seen as a strength and a source of support rather than just another barrier, and respecting that can ensure better outcomes. Language access, as we all know, is a legal requirement, and New York State requires providers to have documents and interpreters for the 6 most common languages, as I mentioned before. American Sign Language is also frequently noted as a language need. And the cultural competency is then related to increased surface use and decreased dropout rates. This we learned when we validated this instrument that we're going to be discussing. Next slide, please. Cultural competency can reduce costs. It can help avoid inappropriate and high-cost care. In the classic Western model, treatment is driven by diagnoses. Providing the correct medication or therapy referral requires accurate assessment and diagnosing. Cultural competency can bridge the knowledge gap of health beliefs, cultural values, and conceptions of recovery. Building on existing community resources, respecting religion and spirituality, and understanding the importance of cultural healing can deflect from costly hospital-based services. Next slide, please. So how were the components of cultural competency determined as we were constructing this cultural competency assessment scale? To do the work of instrument construction, we built on the existing thinking about measuring cultural competency. We assembled stakeholders reflecting professionals and consumers from major cultural groups and had them decide the most important elements of cultural competency that were objective and feasible to collect. These were reviewed in light of influential documentation and recommendations from the Office of Minority Health, who published the class standards, the Joint Commission, who has in the last few years published a roadmap relating to engagement in cultural groups, and the Institute of Medicine. Each of these noted the importance of organizational self-assessment as part of cultural competency. Next, please. So in reviewing these documents and talking with our panelists, we noted that cultural competency really exists on many levels in a mental health system. From the administrative level, the entity that would be the top of the pyramid, that would be a mental health authority or a managed care organization. Next would be the provider agencies and their parent organizations, and we know how complex those interrelationships are becoming. Then each of these agencies have treatment programs and interventions that also need to be culturally competent. And of course, we all recognize that individual clinicians and caregivers need to be culturally competent, but we have long believed that cultural competency should not rest on the shoulders of the clinicians and the caregivers, but that this is an entire system challenge and that it needs to be addressed at all of these levels. And we have recently started to look at a consumer end of the spectrum through what we call cultural activation. Next slide, please. Now, we've developed this framework that is and demonstrates sort of the interacting domains of cultural competency. At the top are a needs assessment that is determining who is in the community, what their needs are with respect to behavioral health conditions. And then an information exchange that includes giving back to the community information about mental health and behavioral health conditions and what kinds of interventions, services, treatments might be available for those that need it. We also note that there are components of the mental health system that are not just the services that are available and provided, but the human resources, the workforce that is providing these services, and also importantly, the policies and procedures that are guiding both the services and the workforce. We also recognize that there are interactions with informal mental health supports and other systems, and we've just listed a couple for reference. And all of this ideally will lead to improved outcomes and reductions in disparities of outcomes and treatment engagement. Next slide, please. So here we have a third polling question.
Yeah, so thank you, everybody, for participating again. So the poll just popped up again, the same as before. Do you currently use or have you considered using a cultural competence assessment for your organization? So many of you earlier talked about how you're incorporating issues and principles of cultural competence. Are you specifically using any type of assessment or evaluation? So yes, we have used one, or yes, we have considered using one, but maybe don't actually have one now. No, we have decided it's not helpful. No, we have not even considered using one or not sure. So we try to give you a couple different options down that path. So if you can hit your response and click submit, we'll follow the same process. The results will pop up momentarily. Great. So do you currently use or have you considered using a cultural competence assessment for your organization of some type? And we'll see everybody's responses in just 1 second. Great, thank you so much for participating. So it looks like a good portion of those who have replied say yes, we have used one or we've considered using one. Nobody has said that they don't believe it's not helpful. So that's I think an important point. And there's a few that we just haven't thought about it or we're not sure. So that's also really helpful as we're talking through maybe introducing, utilizing an assessment that Gary and colleagues have created.
And so here we have another chat opportunity.
Yes, wonderful. Thank you so much, Gary. So again, if you can use that chat box, it'd be helpful to know what have you used in terms of an assessment or evaluation, if that experience has been helpful, or is it still being used? So was it just used once, or is it being used periodically? We have some folks who have replied, and so we have, for example, some have said that cultural competencies are incorporated in employee evaluations in some way. So what each employee's understanding of cultural competence is. I think it looks like some are using some type of an assessment, but it's not maybe a validated assessment. It's an assessment that administration have created and have incorporated into policies. Many of you are using some type of a cultural competence assessment that maybe is in different languages as well. Some use it only in certain sections of the organization, for example, when they're working with clients as part of admission process, but maybe not necessarily as part of the organizational structure or policies and procedures. Right. I think that's sort of, and a few others have mentioned how they've are incorporated in employee surveys, again, on a yearly basis at least. Some are using NISPRI incorporated cultural issues into their comprehensive assessment. So thank you so much. I think this is really helpful to guide sort of discussion around the tool that Gary and others have created.
Okay, so before Lenora describes the overall significance of the cultural competence in the context of measuring it and the specific components of the scale, let me just mention how the scale is structured. We have 11 criteria, and each criterion is measured on a 5-point scale with different activities reflected on a continuum. Each scale criterion includes the rationale, definitions used, and examples are provided for each of the criteria as well. It's very important to keep reminding people about the definitions because we find that we need to have common ground when we're talking about some of these issues. There's a lot of misunderstanding and loose use of terminology. And in case of verification of responses is needed or desired, we also suggest sources of information for validating their responses. Now, we also supplied a copy of the scale. Brianna, can you call that up and just flip through a few pages? So just like the first maybe 4 or 5 pages. So here we can stop at, go back 1 page maybe here. So here we have a sense of what it looks like. Your criterion, the 5 benchmark points, discussion of the rationale, some definitions that are used to be sure that there's common understanding of what we're asking, and some sources of the information. Okay, so now I'm going to turn it over to Lenora, who will continue with the presentation. Thank you all.
Yeah, thank you, Gary. Next slide, please. So why do we need an assessment? I think just almost for anything that we do on a daily basis, we need to have an idea of what we're doing. We need some baseline measures so we know if we're moving in the right direction or not. The assessment will help us to look on the strengths, get a sense of the strengths of our organization, both from activities that we're doing, but also to help us get a better understanding of what our staff brings to the table. Very often we go outside looking for consultants when sometimes we have staff members who are not necessarily positions that will allow us to know that, but staff members are very knowledgeable on a lot of the cultural nuances of the population being served. Next slide, please. So from the assessment findings, we can use the information from the assessment to guide staff development, to promote clinical practices, look for resources, and for me, most importantly, is to create an action plan. We can call it a cultural competence strategic plan. We can call it just a cultural competence plan, but it gives us a framework from which to use to guide us into how we will make our organizational much more culturally competent. Now, a lot of what is in the scale for those individuals on the call that are working with districts or HARPs, or will be working with health homes, all the latest initiatives in New York State to transform our healthcare system, cultural competence is a must. It's not asking, will you do it, or you'll do it because you like to do it. The Department of Health and New York State Office of Mental Health is making it a requirement, and especially for Department of Health, this requirement is actually tied to money. So we're really moving. I'm so excited for the direction in which cultural competence is moving. Lots of hard work, but it really is moving in the right way. And our assessment scale can help you in coming up with a plan of action that can help you move in that direction. Next slide, please. So, Gary mentioned earlier definitions. It's very clear that we need to come, if you're doing cultural competence work, you and your organization, you need to have a clear definition of what it is and what it is not. I'm sure many times when you mention the word cultural competence, lots of folks will have different meanings. Sometimes people say, oh my gosh, it's not that black and white thing again. We did this, it doesn't work, or, you have all sorts of meanings. But to be very effective in what you're doing, we all need to be on the same page. So in any work that we do, we try to get our agencies that we work with or individuals who we have conversations with to begin to understand, here's a definition that will guide us. People may choose not to use a definition that we have used, although I think is a really, really great one, and may create their own. However, there must be something to guide. It's going to be your North Star. So for us, cultural groups is a subgroup that is from the major racial ethnic groups of African American, Hispanic, Asian American, Pacific Islanders, American Indian, or from a recent immigrant or refugee population. It can also be subgroups can be identified by distinct languages, example, Mandarin speaking, Chinese, or locales like, Dominicans among Hispanics. Or a cultural group can also be identified by the organization as a group requiring special attention since features of its culture limit the ability of its members to appropriately access or participate in mainstream service delivery systems. And these subgroups can include, but are not limited to, gay and lesbian communities, people with hearing impaired, and mountain folks, and on and on and on. The one thing I'll say to you and kind of suggest that you may want to think about when you're thinking of your cultural groups, think about collecting the information as well in your management information systems. Because cultural competence has moved way, way, way from theory to practice. It's, if you're looking on, if you've identified your cultural groups, which I know is a part of district, people that have had to do their CNAs, their community needs assessment by now, that's gathering all the data in your community that you're going to be serving, looking on identify your priority groups. If you're going to do that, then you need to be able to have a way to stratify your outcome data by these cultural groups. If it's going to be by race, ethnicity, it's going to be by LGBT, if it's going to be by hearing impaired, you have to have that element in your data as a part of your data requirements. So at the end of the day, you can then say, okay, how are my LGBT folks doing compared to my non-LGBT folks? How are my African Americans who are LGBT doing? You know, you need to come up with, so you can come with strategies and interventions that will allow you to provide culturally relevant and appropriate services to all your cultural groups. Next slide, please. So, definition of most prevalent cultural group, it's some number. I think we use 5% of the population. But the percentage, you can identify a percentage that out of your population, you say, I will make sure that these individuals, I have services that have been modified. So it's not just services, because we all know that the one-size shoe doesn't fit all. So we'll have to modify those services for this percent of your population, or have some way to tailor when you know who you're serving. Now, I'll ask you also to consider, if you have a 5% of the population you serve as your cutoff point, then what happens to the 4.9%? Because you can't just kick them out and say, hey guys, you know, you're not in my 5%, so find somewhere else. So you have to deal with that as well. Next slide, please. Next slide, please. Thank you. Cultural competency defined. Next slide. So the definition that we use for cultural competence, it looks on the congruence of behaviors, practices, policies, attitudes, and structures. So it's not just the training. A training alone will not do it. It will not get into the policies. It won't get into the structures. When we begin to do cultural competence from an organizational level, we have to look on what are the behaviors, what are policies and guidelines, how do those support the behaviors we want. On the call, some of the responses that we got from the polling spoke about having it in performance appraisals. How do we measure that? How do we know that our employees are doing what they're supposed to be doing, and how will we hold them accountable? So you're creating an entire system, and I should say weave in the principles of cultural competence throughout the system so that practices and behaviors will allow for the reduction of disparities, will allow for positive outcomes in the care that we provide. Next slide, please. And I'm looking on the time. In most of the literature, you have the elements of cultural competence. You have the slides. I won't even go through those. As valuing diversity, conduct cultural self-assessment, dynamics of difference, institutionalizing cultural knowledge, and adapt to diversity, again, policy structures, values, and services. What I'd love for you to take away from this slide, that it is not a training. You have to look on every aspect of your organization, from walking through the door to looking on the outcomes data to knowing your community. You really have to have a good sense of those things so that you can achieve the cultural competence. because like I said earlier, most of our funding bodies, I'd say all of our funding bodies in New York State and also on the national level is saying to transform the healthcare system, cultural competence is a must. Next slide, please. And, for the next, I think, 2 or 3 slides, we've added different looks of the definition of cultural competence. When you go through them after, once we've done with the presentation and you have a chance to review the slides, you'll see that they all kind of center around the same thing: attitudes, behaviors, policies, structures. It encompasses, we have to look on all of those to be able to say, to allow us, to give us the opportunity, because there's an opportunity when we serve. When clients come to us, I think it's an opportunity that they have selected us, that they want us to provide them with services. So to allow us the opportunity to serve our clients so that they can have great outcomes. And on the other level, if we go up a step to our funders in the transformation of New York State healthcare system, the big thing, like Gary spoke about earlier, is to achieve AAA, but also to reduce hospitalization by 25% and to reduce disparities. We cannot do or achieve those without doing cultural competence. Next slide, please. Next slide, please. So now we are at, I'm gonna share with you some of the tenets of the Nathan Klein Organizational Cultural Competence Assessment Scale. Next slide. And you earlier, Lydia, flashed on the screen what the scale kind of looks like in its entirety. So it's about several pages, and it really is, I think we did such great work when we developed the scale years ago. Yeah, thank you. Years ago, because we didn't take a lot of stuff for granted, because cultural competence has kind of been sometimes a kind of soft theory. What do you mean? How do you get there? So we went with rationale, we went with definitions, we looked on practical things that an organization could do to help them to accomplish a particular criteria. So if we look on our first criteria, organization's commitment to cultural competence, it really speaks to having a management level person. It's not just saying, okay, Lenore, why don't you do the lunch thing today? Why don't you talk about Kwanzaa? Why don't you? It's actually having someone, an individual that you pay, that is at the management level of the organization, that will guide and ensure the cultural competence of the agency, just like anything else. For accounting, we don't have a receptionist doing accounting or psychiatrist. We have a director of finance who has a zillion staff under them doing all this work. We're suggesting and encouraging that for cultural competence, if you're going to take it seriously, and I think in the transformation, healthcare transformation in New York State, we're being told we need to take it seriously, then you need to have that person who will guide it, or an organization. You can also consult with others to help you. You need a dedicated budget, and you need a cultural competence plan, and you also need to have procedures for updating the plan. And one of the requirements of DISRIP that I'll share with you, or actually most of you know it, is they'll ask what the milestone is to look on the cultural competence and health literacy strategy. To do that, you have to have a plan. You cannot do it without a plan. And they're not only asking you, they're saying, here, I use your CNA to help you develop that. So they're really getting under the hood of what it is that's needed for cultural competence, but also what will it take to reduce hospitalization by 25% and reduce disparities. A second criteria, assessment of service needs. We need to know who we're serving. If you don't know who you're serving, then it's going to be hard to provide the services. If you look on the for-profit world, people like Coca-Cola, like Nike, they know who they're serving. They have a clear idea on who their customers are, where they live, and what they need to do to buy the product. we have been behind in healthcare, in the healthcare field. We haven't taken it as seriously. I think the time is here for us to do that. So you're going to look on your current data. You're going to look, and most of us have that data already. For those who are in district, we have it because we had to submit the community needs assessment that gives a great overview of the provider network and who is in that network. And you have to identify what your cultural group is. You have to identify the language needs. Like Gary mentioned earlier, Executive Order 26 from the Governor's Office has mandated that if you're serving folks, they have 6 languages that speak Spanish, Chinese, Italian, Korean, Russian, and Haitian Creole, then you must provide services at no cost, and not using family members, by the way, to individuals who speak those languages. And I'm sure that if your population of focus has other languages, then you will also have to provide services in the language of the client. The cultural input into organizations and the activities, that, I'm sorry about that, a little tickle in my throat. The agency or the organization has a cultural competence committee or other group that addresses cultural issues and has participation from cultural groups of a target community. So we are kind of broadening the scope. We are acknowledging that we are not the be-alls, we don't know it all, and many times we may think we do. I know as much as I think the cultural competence queen, there's so much that I don't know. So I need to bring in others to help me and help organizations to understand the committee, to understand the groups, the cultural groups in the area, to understand what's working, what's not working, and to help us to shape our cultural competence for the organization, and also in helping us to modify the services that we're going to be providing. Our scale does require that the Cultural Competence Committee has some responsibilities. Now, I know in upstate New York, probably less so in New York City, we don't have as diverse a staff as we would want to. We also don't have the people to make it that diverse. It doesn't mean that we're not going to do cultural competence. So having a Cultural Competence Committee can help you with providing the lens, the cultural lens that you need to begin to integrate cultural competence into your organization and its services. We suggest that the Cultural Competence Committee be also at that leadership level. It reviews services. It reviews programs with respect to CC. And I know I can probably see some people say, we're going to see that happen. So it just means that you have to be more careful in who you choose and how you choose them, because we're suggesting really this committee is going to be working at a high level within the organization. We suggest that the committee reports to quality assurance and quality improvement team, or some team that looks on your overall outcomes of your organization, and that this group participates in planning and implementation of services in your organization, and that the group transmits recommendations directly to the executive level of the agency. If you think about those suggestions, I would like you then to look on, if you do have a cultural competence group in your organization, what are you using that group for? How did you select members? You may want to reconsider, reorganize, relook. If these are the functions that I want, how am I going to get my committee to do that? Sometimes it may mean that you have to train your committee members, because you're going to be asking them. They may have the cultural knowledge, but they may not have some of the requirements, the knowledge to do some of the work that you're going to be asking them to do. And it's okay to train them. Just like how you train staff, then you can train your committee as well, so that they can function effectively and help you to deliver the services that you want and your clients so deserve. Cultural competence, CC staff training activities, that's another one of our criteria, and it speaks to offering or allowing or mandating, requiring staff to actually be trained in cultural competence each year. I think our scale asks for like 4 hours. I think it should go up to just a minimum of 8 hours. There's so much that you can't achieve in just 4 hours because there's so much that we do not know and staff do not know. And I'll tell you, if staff knew how to use the knowledge, then I'll guarantee you that disparities wouldn't be so great. Disparities in healthcare wouldn't be so great. So it's something that you need to, it's not just, okay, you're going to go to a potluck lunch and you're going to talk about rice and peas and plantains and, jerk chicken. No, we have to move the cultural competence training up several notches. And back to assessing our organizations, that will actually help us develop a training plan as to what do we need our staff to know so that they can A, B, C, D, E. We have to really be on it and very different than we have done in the past. To me, it's not enough now to do a cultural competence training, just pull something off the shelf. If we're serious about what we're doing, we actually need to have surveys, monitor the training, make sure the training is modified and adapted for what we want from our organization, track if it's working. If it's not working, what do we need to do differently? We really need to take it up several notches so it can be beneficial to us. And also that when your consultants leave, there's something there that you can build on, you can refine, depending if you have different cultural groups coming in. And it can't just be training as to, okay, what does the Black person want? What does the Jamaican American want? What does the Latino want? What does the Italian person want? It has to be trained at a different level. That kind of training can be a hypothesis, something to start with, but it can't be the be-all and end-all of cultural competence training. Next slide, please. Our next three, next slide, please. I won't do that now. So our next three criteria has to do with staff recruitment. So 6A, 6B, and 6C looks on recruiting, hiring, and retaining staff who are experienced with the cultural groups that we're going to be serving. So we have 6A, who are experienced with a cultural group that you have identified, 6B with the second most prevalent cultural group, and 6C with the third most prevalent cultural group that you're going to be serving. So you're trying to ensure that staff has the experience and the knowledge to serve your population. And you also, the other piece of it, you want to ensure that the policies and procedures are in place to make that happen. And if you can go to criterion 6 for me, please, on the scale, so you can kind of blow that up a little bit. Yeah, I don't know if people can.
I'm gonna zoom in, but if you don't see that, you can also zoom in yourself in that panel. There should be either a plus or minus that allows you to zoom in or out. If you don't
I'm
see,
fine. I can see. I wonder if our participants can see.
Yeah, so the same for our participants. You can zoom in and out yourself if you're not able to see it more clearly.
Excellent.
Thank you.
Excellent. Thank you. So we speak to, and if we, on that page, it has the criteria, a little more detail in what we'd be looking for when we think about hiring, recruiting, and retaining staff. We're looking at all the levels. We're not just looking for the receptionist. We're looking for clinical staff. We're looking for supervisors. We're looking for staff at the administrative level. So, very often we may hire someone who just do direct service. Okay, Lenore is from Jamaica, and so I'll have her serve the Black folks, or I'll have her serve, we see a large West Indian or Caribbean contingent of folks. I'll have her serve them. But what we also need, we need someone who Lenora reports to, who understands what needs to be done, so that in the supervision of Lenora, that person can help to guide to ensure that she's doing what she needs to be doing, and the clients are having the outcomes, the agency is having the outcomes that we need to produce, and that we're tracking disparities and coming up with interventions and strategies that will allow us to reduce the disparities in care. Thank you. Next slide, please. In our 4 criteria 7, which is at the bottom of the last slide, we speak about language capacity, which is huge. If I don't understand what you're saying, that's going to be very, very hard for me to even comply with anything. My culture may say, as a matter of fact, that you're saying the mom, but all I hear when you're talking is wah wah wah. That could be all I'm hearing when you're going on and thinking you're doing such a good job, because one, you're not able to understand me for the language I speak, and you're not understanding me, I'm not understanding you. So that begins to be really a challenge. If you go as an individual, you go somewhere where the language that's being spoken, it's very different from what you know. I think that's when it hits you like, oh my gosh, I have no clue what people are saying. What are they? They're smiling. Are they smiling with me? Ask me, am I supposed to be doing something? And sometimes that's how it comes across to clients who are very different. And we've had some experiences in New York State where clients have actually, there's a particular client that actually died in the emergency room, and it was all because of language that no one understood. They didn't take the time to understand what's going on, and that person's life, that person is no longer with us. There have been several lawsuits as well based on that. I'm not saying that people are going to sue you, but because this particular part of the scale, it's linked to the law. There are laws that says, federal laws that says you must do this. And if you don't do this, then A, B, C, D, E. So you're kind of opening up yourself. If you do not understand the population, you do not look on your community needs assessment in detail to begin to understand who is in my population, who am I serving, what are my language needs. The other piece I want to suggest to you, because I think people with very good intentions, organizations, great intentions, but when they're submitting or responding to a proposal to an RFP, it's a good right if I want to reduce disparities. I want to serve all the Latinas. I want them to do da-da-da. And my Haitian Creole friends, I want to do so. However, in the budget, there isn't a line for language. And it can be a huge cost. So I'm going to suggest to you that in responding to RFPs and those things, you begin to look on what are the requirements that I need for cultural competence, what do I need to do, and put that in your budget. It's not going to happen if there is the budget line. And next slide, please. And we have several more criteria. We have language capacity, where it covers key forms, the forms that you use. We also speak about limited reading skills. We have to look on the academic level of our patients. Are we going to have forms and descriptions of services at an 8th grade level when your clientele is at a 4th or 3rd grade level? We need to make our assessment scale addresses that as well. And our last criteria, of course, addresses the adaptation of services. One size shoe doesn't fit all. And if that's the case, we need to understand our population. We need to make adaptations and modifications to our services so that our clientele can be properly served. And I think, next slide, please. And yes, and now I'm going to turn it over to Lydia. I'm giving you 4 minutes, Lydia. I hope that's enough.
Thank you so much, Lenora. I think this is wonderful. We have a few questions that have come in. I do want to highlight that you can go to their website to access additional information, resources, slides, videos, as well as the tool at cecc.rfmh.org. We also will be able to post the webinar recording and slides and the tool on ctechny.com website, so you'll be able to access it through a few different ways. I'm just going to go ahead and ask, Lenora and Gary, any specific questions that have been coming in. We have a couple. We have a couple minutes. Feel free to submit others. What do you think about having children or families participate in the agency's cultural competence orientation or ongoing trainings in some way? And there was another similar question around incorporating the community as part of building cultural competence in an organization. So what suggestions do you have around doing that?
I think it's imperative that the community is a part of your cultural competence initiative. It really is. They're great stakeholders. And in New York State, we're doing a lot. And so, as a matter of fact, one of the projects for Department of Health is population health. We're talking more about communities because our individuals or patients come from communities. They go back to communities, and the community's involvement can help us and we can help them. It's a win-win for all. For children, and it's going to be tough depending on the age group of the child. So you have to kind of monitor that. However, what you need to understand that a lot of times youth or adolescents or children in general will identify themselves differently from a cultural perspective than their parents do. So the assumption that their parents identify themselves as, let's say, I may say Jamaican American, my daughter may say American, period. So, we just have to be careful with that and knowing who you're serving, is it the child or the parent? And you need to know, because in some cultures, that has brought a lot of angst among children and their parents. So that can be the problem that you're dealing with. But definitely, as much as possible, I would say find ways. It could be through focus groups. So you'll have something very not a structured assessment, cultural assessment, but it could be like for younger children, finding ways to ask them the questions. You're not going to ask them, do you think our services are culturally competent? They're going to hear wah, wah. You have to break it down for them as to what it means. And there'll be more than I know they will share with you. I have done that.
Great. Thank you so much, Lenora. And we have sort of another theme in terms of some other questions. We have a few folks that have asked us around incorporating families or participants or consumers with disabilities, both intellectual and developmental as well as physical challenges, and ways of doing that. And then I'm just going to piggyback the second question is that we have some folks that say, well, if they primarily serve one culture, so let's say if they primarily serve a Caucasian culture or that's who's in their community, how do they work towards being more culturally competent? So I think the idea being is how do you expand the understanding to incorporate folks who have disabilities of some sort, as well as how do you continue to work around cultural competence if you're primarily serving one community?
Okay, and I'll take that quickly because they're both there. When we think of, people should think of white or Caucasian, I say European American. That's my gig I've been using for the last few years. And I'm saying that because I want you to think about how people really identify themselves. So I have done work in a rural community here in upstate New York, Yates County. And Yates County, when you look on their census, probably about 98%, 97, 98% European American. So why need cultural competence? However, when you drive through the county, you see a lot of buggies because Yates is a huge Amish county with Amish individuals who identify themselves as Amish. Huge settlements of individuals. And to serve that county, you have to understand the Amish. You have to understand how they live, how they respond to services, what languages that they speak. So to think that here they look white or look, like European Americans, they are European Americans, so the color of their skin is one thing, but English is not their primary language. So if you don't know that, you're going to miss it by a mile. The way they engage with their children, the way farming, it is huge. You cannot provide the services unless you know the nuances of that culture. And you have other culture. People talk about the rural culture. What does that mean? But you have to break it out. Or unfortunately, our data systems does not allow us to be more granular. I'm waiting for the day when we can have people begin to identify themselves like I'm more Italian, I'm more French, I'm more Irish, so then we can begin to dice and stratify our data like that. And the Cultural Competence Committee, of course, if you're serving folks, anyone you're serving, most anyone you're serving can be a member of your committee. You just have to have the patience and the willingness to do that. When I work with counties in doing consultation, I do suggest that individuals are on the committee because it's them you're serving. Why have a committee without the folks that you're serving? It is not going to be like your finance committee. It's going to be different. So you have to work differently to get good results, and so
Wonderful,
that they can
Lenore.
provide you with the lenses.
Great. Thank you so much, Lenore. And I think the message is that no matter who you're working with, whether it's a variety of cultural, race, ethnicity, or a variety of different backgrounds or disabilities or what have you, is to take the time to kind of get to know and understand the populations and make sure that the policies and the practices are relevant to the people that you serve. So thank you so much. We need to wrap up now. I wanted to give some brief information on CEUs and how to access it. For those of you who have participated in the full webinar, you will be receiving an email from us by tomorrow on how to access the NYU Silver School of Social Work CEU processing webpage. You will be asked to submit some information, register with them. There will be a nominal fee of $15 to process the CEU. Again, this is separate from CTAC. This is NYU Silver School of Social Work is our CEU provider that is licensed by the state to be able to deliver the CEUs. You'll be asked to complete a brief knowledge test, and then you'll be able to get your certificate. So all those who have attended today's webinar, you'll receive an email from us by tomorrow giving you that information. Thank you so much for participating in today's webinar. If for some reason you only called in but you did not actually view the webinar through the webinar system, please send CTAC an email, or you can send me an email directly at lydia.franco@nyu.edu, lydia.franco@nyu.edu, or our CTAC email. Feel free to reach us. Feel free to reach Gary and Lenore as well with some additional questions. Our next webinar will have Dr. Carol Siegel and Lenore Reed-Rose again on April 29th from 12 to 1. There's one social work CEU for that webinar as well, but that one will be specifically focusing on the program level as well as opposed to the organizational level around building cultural competence and aligning with healthcare reform. Thank you so much both to Gary and Lenora for joining us today and presenting such a wonderful webinar. Thank you to all of you for participating. Please have a wonderful day.